You've probably heard that high blood prolactin levels, hyperprolactinemia, could cause fertility problems and even problems with the menstrual flow, could cause nipple discharge, what we call galacturia, and some other problems, reduced libido, sexual drive, and all of that. But the question is, does a high prolactin level or a raised prolactin level always mean that there is a problem? Is it possible to have a raised prolactin level and not have menstrual irregularities, not have infertility problems, not have nipple discharge? The answer is yes. There's something called pseudo hyperprolactinemia, which means it's not a truly raised prolactin level. How we usually detect that is that the lab, usually when the lab, not all labs do it, but usually some labs, maybe some more specialized labs, when there is a high prolactin level, they will also check for what is called macroprolactin. Now, macroprolactin is not biologically active. It's prolactin that is bound to proteins in the blood, other proteins in the blood, which usually things like immunoglobulins, and sometimes it could be bound to albumin. So it's not biologically active, which means it doesn't produce symptoms, even though the levels are high, right? So someone that has high macroprolactin levels will, if the macroprolactin level is high and the unbound prolactin level is normal, then that person will not have low libido, menstrual problems, or even infertility or nipple discharge. So it's very possible. It's just for you to know that the fact the fact you've gone to a lab and they've told you your prolactin level is high doesn't always mean that you have a problem. It doesn't even always mean you have a pituitary tumor or a brain tumor. If it's mostly or all macroprolactin, then the chance that it's not coming from a pituitary adenoma or a pituitary tumor is very high. So you're more reassured. But irrespective of whatever is causing it, if you have a high prolactin level, speak with your doctor. Your doctor will guide you in terms of interpreting the results based on the symptoms that you might be having or not having. All of those things would add up and, give us better insights so we can help you and direct you, properly.